Rising to the challenge of treating COVID-19, staff are brought into this clinic, set up behind the Garran Surge Centre. It's a new front line in the capital's pandemic response, where positive patients will receive an infusion of a drug aimed at easing their suffering.
It won't cure COVID, nor will it shorten its disease process, but it will help with the symptoms of COVID.
Approved for use in August, doctors say sotrovimab is highly effective, but only if it's given quickly.
We have to get it in within 5 days of them, having COVID, and so being symptomatic for 5 days or less is one of the criteria that they need to meet.
To speed up that process and avoid the risks of going into hospital, patients will drive themselves or be transported to the clinic for an infusion of the drug. And if they deteriorate further, staff will call for an ambulance.
It's not ideal, but most people, if they have caught the symptoms early in the disease process, this will benefit them and not having to come into the hospital system.
It's not the only factor that's far from ideal, with staff having to change into and out of personal protective equipment in the Surge Centre or in tents outside, which they'll have to wear the entire time they're working. The trailer itself has no toilets or a break area.
Is it really comfortable for our nursing staff, given that they'll be doing their normal shifts in this facility? And why are we not doing it in the Garran Surge Centre? So the Surge Centre was built for these exact types of needs.
Authorities insist the space is well ventilated and equipped with air purifiers, with patients to be treated inside protective hoods and staff given regular breaks.
We're feeling quite safe, and we'll follow the same practices we've done on the COVID wards, and nothing will change there of all our donning and doffing of PPE.
We'll consider whether to move that treatment into the Garran Surge Centre. But the Surge Centre at the moment is being used as a testing site, and we had this fantastic facility in partnership with the University of Canberra that was being made available to us. It's a safe and appropriate clinical setting.
Just how long sotrovimab will remain an effective treatment is also uncertain.
This drug works well when there hasn't been an immunity or time for immunity formed in the patient. As Canberrans have done a really good job of getting vaccinated, there may be less and less of a window for this drug here in our population.
But new treatments are on the way and will no doubt be needed in the months to come. Harry Frost, ABC News, Canberra.